Are you preparing for medical coding interview? Then this video is for you. Are you confused of what to prepare and what are the questions asked in the medical coding interview? In this video, I'm going to share my experience and questions of my HCC medical coding interview so that you will get an idea of what are the questions they are going to ask and how to prepare for the interview so that you can be confident about the interview and crack the medical coding interview and land into your dream job. Before going into the video, please like, share and subscribe to my channel. So let's start the video. First question, tell me about yourself. This is the first question in any interview, so you have to be well prepared for this question. I am a certified medical coder, passed a CPC exam in so and so month and so year with a pass percentage of 93. I have sound knowledge of anatomy, physiology, medical terminology, ICD and CPT guidelines. And my medical qualifications include Masters in Pharmacy from so and so college, and I was awarded with UGC scholarship in my master's for clearing the GPAT exam. And I am from Hyderabad. So this is what I told in the interview. So the main eligibility for medical coding post is certified medical coder. So you have to tell that point first. And if you have a good pass percentage, then you can tell your pass percentage also. I got 93% in CPC exam, so I told the pass percentage. And what are the skill requirements for medical coding interview? Anatomy, physiology, medical terminology, ICD and CPT guidance. So you have to mention that skill in your tell me about yourself to represent as you have a sound knowledge or you have a basic knowledge of anatomy, physiology, like that you can tell. And next you should tell about the your educational qualifications. What is your graduation, post graduation, and if you have done any projects and poster presentation, paper presentation, you can also include all those things in your this section. Tell me about yourself and in educational section. And what is your place from where you are coming, like that. So this is the first question asked in any interview. So be well prepared and write down some points from your resume, simple points like small sentences and in simple English, so that you can represent as it is in the interview. Next question will be from anatomy, physiology. Tell me about an organ system. So my recruiter asked, you can tell about any organ system you like. So this is the first question from our subject, anatomy and physiology. So they will ask any organ system. Either they will mention to tell this organ system, or they may ask like generalize, whatever you want to tell you can tell. So it will be better if you prepare to organ system very well. You can prepare other organ systems briefly, so that you will have a knowledge of all organ systems, and also you can tell that I am very comfortable with this organ system, so I tell this organ system, whatever you prepared very well. While preparing the organ system, consider these points and prepare. First we have to write down what is the function of the organ system, main function of the organ system, and what are the body parts present in that organ system, and what are the functions of different body parts in that organ system, so that you will it tells that you have the overall knowledge of that organ system. Whatever you are preparing is not important. Whatever you are representing and whatever you are telling before the recruiter is important. So if you write that in simple sentences and in simple English, then it will be easy for you to tell or represent before the recruiter. Even though you read so many books, like big books, and you are not able to represent before the recruiter, it will be no use. The recruiter will think that you don't know anything. So prepare in simple sentences so that you can represent as it is before the recruiter. I told about cardiovascular system because I prepared cardiovascular system very well. The cardiovascular system is responsible for delivering oxygen and nutrients to the cells of the body. It consists of the heart, blood vessels and blood. The heart is a muscular organ located in the chest that pumps blood throughout the body. The blood vessels include arteries, veins and capillaries, which transport blood to and from the heart and various organs. The heart is divided into 4 chambers: the left atria, right atria, left and right ventricles. The atria receive blood from the body and the lungs, while the ventricles pump blood out to the body and the lungs. Arteries are blood vessels that carry oxygen-rich blood away from the heart to the rest of the body. Veins are blood vessels that carry oxygen-poor blood back to the heart. And coming to capillaries are the very small blood vessels that connect arteries and veins and allow for the exchange of oxygen, nutrients and waste products between the blood and the cells. So finally, the cardiovascular system is essential for maintaining the overall health and function of the body. Cardiovascular system, where I covered the function of the organ system and also explained about different body parts in the organ system. Like that, you have to prepare for almost every organ system, so it will be easy for you to tell in the interview. Next question. Tell me about nephron. So this is also an anatomy question. Anatomy physiology question. Nephron is a structural and functional unit of kidney. It filters the blood and removes waste products and excretes them as urine. Nephron consists of different parts: glomerulus, Bowman's capsule, renal tubule and collecting duct. So glomerulus made up of blood capillaries where filtration occurs between capillaries and Bowman's capsule. In tubules, exchange of salts and ions happen with formation of urine. Urine is passed through collecting duct to urinary bladder for storage via ureters from urinary bladder. Urine is passed out through urethra. So this is the second question. Next question is a ICD guideline question. Explain about sequela. Sequela. So my answer was sequela, the late effects of injury. The seventh character S is for complications or conditions that arise as a direct result of injury, such as scar formation after the burn. When reporting sequela, we need to report the sequela with two codes. First condition means the etiology and second will be the late effect or sequela. So sequela is the late effect of injury. It is represented by the seventh character S. So after anatomy physiology questions, they will ask about either medical terminology questions or ICD guidelines. In that ICD guidelines, they start with general guidelines and they will go to the chapter specific guidelines. So in my interview, the medical terminology or questions not asked. Next, explain guidelines of neoplasm. The answer is neoplasm means an normal growth of tissue in body. So when the patient comes for primary cancer, then the principal diagnosis will be the primary cancer. If the reason for encounter is for secondary cancer, then the principal diagnosis will become the secondary cancer and primary cancer will be given as an additional diagnosis. And when the patient came in for anemia and with the neoplasm, then the principal diagnosis will be the malignancy and secondary diagnosis will be the anemia, because the malignancy is the etiology. So we have to code the malignancy as the primary diagnosis. When the patient, if the reason for encounter is dehydration with malignancy, then the principal diagnosis will be the dehydration and the secondary diagnosis will be the malignancy, because the reason for encounter is dehydration and the treatment is towards the dehydration. Then so the dehydration is coded as principal diagnosis. Next, when the patient comes in for therapy of neoplasm, like immunotherapy, radiotherapy or chemotherapy, then the principal diagnosis will be the therapy code, Z code. Then the secondary diagnosis will be the neoplasm. If the patient comes in for pain with neoplasm, then the principal diagnosis coded will be the pain and secondary diagnosis will be the neoplasm. So these are the guidelines for neoplasm. Next question is, can you tell me about HIV guidelines? HIV means human immunodeficiency virus. Guidelines include code only confirmed cases. So the first guideline for HIV is code only confirmed cases, and HIV consists mainly of two codes: Z21 for HIV test positive and known HIV, and B20 for HIV disease, HIV related illness, and AIDS, acquired immunodeficiency syndrome. Patient when comes in with inconclusive serology, then we have to code R75. If the patient comes in for HIV counseling, then we have to code Z71.7. If the reason for encounter is HIV related illness, then the HIV is coded first, then secondary diagnosis will be the illness, because the etiology is the HIV. Then we have to code the HIV as the principal diagnosis. If the reason for encounter is HIV unrelated illness, like in emergency conditions like a traumatic condition, fracture, then we have to code the fracture as a principal diagnosis and HIV as a secondary diagnosis. So these are the this is an overview of HIV guidelines. Next ICD question is, tell me about NSTEMI guidelines. Type 1 acute myocardial infarction is further divided into ST elevated myocardial infarction, that is STEMI, or non-ST elevated myocardial infarction, that is NSTEMI. If NSTEMI turns into STEMI, then we have to code for STEMI. If the STEMI becomes an NSTEMI due to thrombolytic therapy, then also you have to code STEMI. So in either case, NSTEMI or STEMI, you have to code for STEMI only. For up to 4 weeks or 28 days after the heart attack, we have to code I-21 series. And after 4 weeks, we have to code for appropriate aftercare code. If the person is having old or healed heart attacks or old or healed MI, then we have to code for old myocardial infarction I-25.2. As it is a HCC interview, they concentrate more on the ICD guidelines and anatomy physiology. What are the different chapters of CPT? The CPT, my answer is, the 6 main sections of CPT are evaluation management, 99,000 series, anesthesia, surgery, which is further divided into different categories based on body systems, radiological procedures, 70,000 series, pathology and laboratory procedures, 80,000 series, medicine services and procedures, 90,000 series. And surgery is further divided based on organ systems into integumentary system, musculoskeletal system, vascular system, cardiovascular and lymphatic system, respiratory system, endocrine system, digestive system, nervous system, and eye and ear. So these are the different chapters of surgery. So next question is, what is modifier? A CPT modifier is a 2-digit code that is added to a CPT code to provide additional information about a medical procedure or service provided by a physician. The purpose of what is the use of adding a modifier to the CPT code? The purpose of a modifier is to further describe the code procedure without changing its meaning or description. So what is CPT modifier? CPT modifier is a 2-digit code added to the CPT code to tell about additional information without changing the code description of that CPT code. So we are giving additional information without affecting the CPT code. Explain any modifier. Modifier 73 is used to indicate that a surgical or diagnostic procedure requiring anesthesia was terminated due to circumstances that threatened the well-being of a patient after the patient had been prepared for the procedure. So CPT modifier 73 is used when the person is prepared for any procedure and terminated without completing the procedure for well-being of a patient. For example, colonoscopy. If the provider prepared the patient and introduced the colonoscopy through the mouth into the esophagus, stomach, and after reaching the stomach, if the person is continuously bleeding, if the provider is not able to stop the bleeding, and for the well-being of the patient, if the procedure is terminated, then you have to code the modifier 73 because the patient is prepared for the procedure. For that purpose, we have to code the 73 modifier to the CPT code colonoscopy. Second modifier is CPT 53 modifier, which indicates procedure discontinued by a physician or other qualified healthcare professional. Example is chest X-ray for use. So it is a procedure which is discontinued by the physician. It is a modifier used when the physician intentionally reduces the procedure or discontinues the procedure. For example, chest X-ray 4 views. So actually the provider has to view the chest in 4 views, but he did only 3 views. With the 3 views only, he is satisfied with whatever the result. So he did not took the 4th. For that, we have to code the 53 modifier because the physician intentionally reduced the procedure to the 3 views. So here we have to add CPT3 code. We have to add CPT modifier 53 to X-ray code. So this is the modifier. So these are the questions of my HCC medical coding interview. So hope you all got an idea of what are the questions they are going to ask and how to prepare for the interview. All the best for your interview, and don't forget to subscribe my channel for more videos on medical coding interviews and also CPC exam.